On behalf of UN Population Fund's Asia Pacific Regional Office, we greatly appreciate this opportunity to present this proposed initiative to deliver gender-based violence services to women and girls in Papua New Guinea and Timor-Leste. UNFPA is one of the UN's leading agencies working to address gender-based violence. Through long-standing country presence and well-established partnerships with national development partners, we strengthen national capacities and mechanisms to ensure quality and timely response to survivors of gender-based violence. Gender-based violence is a major concern in the Asia-Pacific region, with the prevalence rate of lifetime experience of intimate partner violence ranging from 15 to 59%. As you can see in this illustration, the Pacific region has the highest recorded rates of violence against women and girls. Analysis of the lifetime and last 12 months experience of violence in the region shows that in many countries, it is very difficult for women who live with violence to find support to make the violence stop or to leave a violent relationship. Given this high prevalence rate in the Pacific, we are proposing to focus this initiative on two countries in the region with the highest prevalence rates, Papua New Guinea and Timor-Leste. The magnitude of gender-based violence is considered to be of epidemic proportions in Papua New Guinea and Timor-Leste. In a recent study, 58% of women in Papua New Guinea reported having experienced some form of physical and/or sexual violence in their lifetime. In Timor-Leste, almost 2 out of 3 Timorese women report having experienced intimate partner violence in their lifetime. The tolerance for gender-based violence is also very high in both countries, and the multisectoral coordination mechanism is extremely weak. Despite growing awareness of gender-based violence as a life-threatening violation of human rights, poor quality of services and lack of coordination among multiple response sectors such as health, police, justice, and social services have been a major impediment for effective response to GBV in Papua New Guinea and Timor-Leste. Therefore, building on the strong global and regional evidence base on what works for effective response to GBV, as well as UNFPA's ongoing partnership with the respective governments in these two countries, this initiative aims to ensure that women and girls who experience violence are able to access quality and timely life-saving GBV response services. So what concrete outcomes can we expect from this initiative? Well, first of all, frontline health sector providers equipped with knowledge and skills in the latest international guidelines to deliver timely and quality services to survivors of violence. And secondly, multisectoral coordination mechanisms in place, linking the various sectors in a coordinated structure so the burden of seeking services is not on the survivors. The key strategies for this initiative include sustained investment in the capacity of health systems, so every survivor has access to services that they need and feel respected, safe, and in control of their choices while doing so. The focus on health sector is a deliberate strategy, as healthcare providers are often the first professional contact for women who have experienced violence. For many women, a visit to the health facility may be her first effort to seek help and the only chance to receive support and care, as well as to escape a situation of abuse. At UNFPA, we abide by a survivor-centered approach, which is an evidence-based framework that takes into consideration the needs, wishes, and well-being of each survivor, and for providing services that prioritizes their safety and recovery. In line with this, the initiative will provide technical support to set up and strengthen multisectoral coordination and referral mechanism for timely and quality support to survivors of GBV. The initiative will partner with community-based organizations to ensure there is awareness about available GBV services, as well as creating an enabling environment for survivors to safely access these available services. With the global pandemic of COVID-19, we are all living in unprecedented times and with exceptional challenges, particularly those who are already in situations of violence and abuse. In many contexts, the measures deemed necessary to control the spread of COVID-19, such as restrictions of movement, reduction in community interaction, and closure of services, are not only increasing the risk of exposure of gender-based violence for women and girls, but also limiting the ability of survivors to distance themselves from their abusers and to access services. Therefore, the focus of this initiative, supporting survivors of gender-based violence, is all the more important. We have adapted the program strategies to ensure that we're able to deliver on this investment in the most efficient manner. Some of these strategies include remote delivery of startup activities, front-loading activities that can be done while observing social distancing, such as development of training materials, and prioritization of local implementing partners over international ones, not just to ensure the deliverables are met, but also to ensure sustainability. In both Papua New Guinea and Timor-Leste, UNFPA has been a long-standing partner to the governments and their different departments to strengthen the national policies and mechanisms to address gender-based violence. So in terms of sustainability, the activities will be led by respective line ministries and institutions, which will strengthen their continuation post the project completion. For example, the ministries of health in each of the two countries will ensure the critical role that the health system and healthcare providers can play in terms of identification, assessment, treatment, documentation, and referral of GVB survivors is integrated within the national health programs and policies. UNFPA country offices will ensure that promising practices as well as lessons learned are documented for future scale-up as well as for advocacy. As both Papua New Guinea and Timor-Leste are also part of EU-funded Pacific Spotlight Initiative program, we will ensure that the initiatives are complementary and not duplicative. The total investment requested for this initiative is $1 million US. With this, we expect to engage over 315,000 people in Papua New Guinea and Timor-Leste while investing in a sustainable system for survivor-centered support. We thank you very much for your time and for your consideration.